before coming to the signs and symptoms, before we need, if we need to brief up this pathophysiology, then pathophysiology in a brief way, we can tell like there is an imbalance between the protective factors and there is a increase in the acid secretion factors. We can list out all those like uh, due to imbalance the factors that protect against the acidity and the factors that increase the acid secretion that leads to mucosal damage. Okay, you can brief it like the factors that protect against acidity and the factors that increase the acid secretion. What are the factors that protect? Is the mucus protects and the bicarbonate layer, the bicarbonic acids which are produced from the pancreas, the blood flow to the kidney, and the cell renewal, the pancreatic cell renewal, sorry, the parietal cell renewal, and the prostaglandins, and the factors that increase acid secretion are the acid, pepsin, bile acids, NSAIDs, H. pylori, the alcohol, and the pancreatic, and like caffeine, coffee. And now let us discuss the signs and symptoms. What are the signs and symptoms are? The common signs and symptoms include first thing is epigastric abdominal pain, bloating, abdominal fullness, nausea and vomiting, weight loss or the weight gain, hematemesis, and the melena. These are the common signs and symptoms. And what are the warning signs and symptoms? The warning symptoms or the alarm symptoms that should prompt urgent referral include in that unintentional weight loss, progressive dysphagia, and over gastrointestinal bleeding, iron deficiency anemia, recurrent emesis, and a family history of upper gastrointestinal bleed is a malignancy. In this, let us discuss one by one and let us explain that. Then the first one is the epigastric pain. What is this epigastric pain? The pain in the epigastric region. Firstly, let us discuss what is the abdominal pain. The abdominal pain can be induced by the stimulation of the visceral nociceptors. The activation of this, what is this nociceptors? So the pain receptors usually require the previous sensitization by pathological events such as inflammation, ischemia, or acidosis. Let me write it. Abdominal pain can be induced by stimulation of visceral nausea, visceral nociceptors. Activation of this nociceptors usually requires previous sensitization of previous sensitization by pathological events such as inflammation, ischemia, or acidosis. And based on the site of the pain, the disease can be diagnosed. And we told that this is an epigastric pain. There is the pain can be diagnosed based on the site of its action. The epigastric region, we have the spleen, and if the patient is suffering with epigastric pain, then the patient may be suspected like the patient may be having the gastritis or the splenic disorders. The splenic disorders, we have the abscess or the rupture of the spleen. Okay. And the next one coming to bloating. What is bloating? The abdominal bloating is when the abdominal is feels like full or tight. Abdominal bloating is when the abdomen feels full and tight. It commonly occurs due to a buildup of gas somewhere in the gastrointestinal tract. The bloating causes the belly to look larger than usual, and it may also feel tender or painful. And this is called as bloating. And in the GI tract, we have the microbial flora, and which can be called as the microbiota. The GI tract has the microbiota that plays a important role in host immune system. This GI microbiota can be divided into two ecosystems. They are the luminal bacteria and the mucosa associated bacteria. In the luminal bacteria is responsible, which is present in the majority in the GI tract. Luminal microbiota is majorly found in the GI tract flora, and this is responsible for bloating. Like uh, when the unabsorbed carbohydrates, which is present in the GI tract, By the help of the subliminal microbiota, they are converted into short chain fatty acids, and the byproduct released is carbon dioxide, that is the gas. Okay. And this gas is responsible for bloating. And there is also one more mechanism by which gas this is seen is when we eat more fiber or sorbitol containing foods. What are the sorbitol containing foods? Examples are the apples, pears, apricots, plums, cherries, and dried fruits. Yeah, one second. The dried fruits, the dried fruits, there are some low producers of the methane. They produce low methane, and this methane is responsible for increased bloating. Sorry, they are the high producers, they're not the low producers. The high producers, the high producers of the methane and causes the increase in bloating. Okay, and let's continue. The next one is abdominal fullness. Abdominal fullness, as we already discussed, impaired gas handling, which is due to the altered gut microbiota. The, the abdominal fullness is seen.